Hi, my name is Jackie, and I did my presentation on chlamydia. Let me just pull it up. Here we go. Okay, so I did chlamydia. Chlamydia trachomatis is a common sexually transmitted infection caused by a bacterium that affects millions worldwide. Despite it being easily treatable, it remains to be one of the most prevalent sexually transmitted infections, especially around like young adults. Chlamydia is a bacterial infection that exists in two forms: infectious elementary body and intracellular reticular body. It is a gram-negative bacterium that begins when elementary bodies attach to membranes of the cells in the epithelial layer of the urogenital tract. Elemental bodies then enter the cells, and about 2 hours later are transformed into reticular bodies, which then divide and grow over the next few hours, infecting the cervix, urethra, anus, throat, eyes, penis, and vagina. The most common way to get chlamydia is through unprotected vaginal, anal, or oral sex. Sharing unwashed sex toys or contact with genital fluids, semen, or vaginal fluid is also another way to be infected. But the most common is obviously unprotected sex. Chlamydia trachomatis cannot survive outside the body, so the best way to limit this bacterial infection would be to have protected oral, vaginal, or anal sex and to be tested for sexually transmitted infections on a more frequent basis. And I guess just kind of knowing who it is that you are engaging in these activities with and making sure you're both clean. Chlamydia, like many other sexually transmitted infections, can have no signs or symptoms, but can still be infectious. Some signs or symptoms include pain or a burning sensation while peeing, pain during sex, lower belly pain, abnormal vaginal discharge, pus, watery or milky discharge from the penis, swollen or tender testicles, pain, discharge, and bleeding from the anus can all be symptoms. These symptoms occur because there's inflammation in the urinary tract, testicles, or uterus, depending on the sex. If left untreated, women may develop pelvic inflammatory disease and can develop fertility issues, ectopic pregnancies, or pregnancies outside the womb. If left untreated for men, they may develop painful infections in the testicles and epididymitis, which can lead to infertility. A chlamydia trachomatis has a survival rate of 95%. It is very unlikely that one will die from chlamydia, but if it's left untreated, it can keep developing and developing, and you'll be spreading it on to more people. Chlamydia and gonorrhea also kind of are one of the most like commonly together sexually transmitted infections. So just kind of be aware and be careful about that. Um, Chlamydia is pretty easy to diagnose. There are two simple tests that can be done. A urine test is the first one. It is analyzed in a lab to determine the presence of the infection, or a swab exam can also be done. A sample from the cervix, vagina, throat, or anus is collected for testing. For most people, chlamydia can be treated with antibiotics. Doxycycline and azithromycin are most commonly prescribed antibiotics, which are taken for about a week. Once the treatment is done, the person should be cured, but they can be reinfected to continue to have unprotected sex with the same person that had given it to them in the first place, or new people that could give it to them. Sexually active women ages 25 and younger are the ones who are at the highest risk for chlamydia trachomatis, but anyone who's sexually active with multiple partners can also be at risk. The incidence of chlamydia in the US was about 1.8 million new cases in 2019, while in England there were about 229,411 new diagnoses. Sorry. The prevalence of chlamydia in men in the US is 356.4 to 363.7 per 100,000. For women in the US, it is 628 to 621.1 per 100,000. There are AI models to help discuss that to AI models available to diagnose and help with creating treatment plans. There wasn't much about it that I could figure out. I think everything is just kind of in the works right now. But in conclusion, chlamydia trachomatis remains to be a significant public health challenge due to its high prevalence, asymptomatic nature, and potential for severe reproductive health complications. Effective management and control of chlamydia infections hinge on early detection through routine screening, appropriate treatments, and comprehensive sexual health education. And these are my sources. Thank you.